Hello, my name is Tony Edelman. I'm also a Northwestern student, and I will be discussing the population at risk for CLABSI, hospital policies and procedures, and the National Patient Safety Goals. First, we want to talk about patients in the ICU. They often have multiple catheters that are emergently placed, assessed repeatedly for an extended length of time. The vulnerable population includes hemodialysis patients, surgical patients, and oncology patients. You also have independent risk factors, patients that are in the hospital longer, their catheters are in longer, heavy microbial colonization at the insertion site, internal jugular catheters, femoral catheters, neutropenia, increased patient ratio in the ICU, patients receiving TPN, poor catheter care, and transfusion of blood products in children. Next, we'll discuss the hospital policies and procedures and the National Patient Safety Goal 070401. The infection prevention and control policy discusses IV therapy and addresses not only the central venous access device but also peripheral venous catheters, arterial catheters, and placement and removal of those lines. Central venous access device dressing change policy discusses the importance of masking, changing the catheter caps, antimicrobial skin cleansers, and special considerations. It also tells you how to document the procedure, because if you didn't document it, you didn't do it. And there are separate policies that include PICC line and portacath dressing changes. There are also policies available to assist with line insertion, changing the needleless connectors, flushing and locking of catheters, blood sampling, and how often you should do the IV tubing changes. Next is the National Patient Safety Goal, evidence-based practices to reduce the risk of developing a CLABSI, and the Joint Commission has 13 elements of performance. The first one's going to be education of staff. Anyone who is directly involved in the management of central lines need to be educated. Normally this is done when they're hired and then annually thereafter for competencies. You also want to educate your patient. We're required to give this handout to all of our patients prior to insertion of a central line, and I have given everyone a copy. It just tells you what to do to reduce your risk, and it helps to involve your patient. Next, we're going to talk about, you should have policy and procedures on the preventions of CLABSIs, which should be aligned with regulatory agencies such as Joint Commission CMS. Next is risk assessment. Usually infection prevention assists on that, and they help make sure that we're in compliance with evidence-based policies and procedures. They also have to provide infection rates and outcome data to those agencies. They require you to use a central line procedure checklist and standard protocols. And then, of course, hand hygiene is the single most important step in preventing infection. We can continue with elements of performance. You want to avoid use of the femoral site. It's usually used in an emergent situation such as a code or something like that. So as soon as you can, you need to look for an alternate site to use, because just the proximity of where it's located, they're bound to get an infection. They also require you to use either a standardized kit or cart for insertions and standard protocols. Evidence shows that using the same practice over and over helps to reduce the risk of infection. You want to make sure you're using an appropriate skin antiseptic that is approved through best practice. You utilize standard protocols for catheter hub and injection port disinfection. At the hospital here, we use Curo caps, which is a green little cap that screws on and is impregnated with alcohol, and that has been shown to reduce infection. You want to evaluate line necessity routinely. I recommend every shift to ask yourself, does the patient really need this line? And if you're not using it, take it out. It used to be that if it wasn't out of date, you'd think, well, we have this IV,